The following video will describe and demonstrate the correct way to perform an oral cancer screening exam. The purpose of this exam is to detect cancer early, thus increasing the prognosis for the patient. Oral cancer can develop in any person of any age, but people with the highest risk factors are smokers or ex-smokers, those that use alcohol, have a poor diet, or that have been diagnosed with the human papillomavirus, or those that are at an increased risk for the human papillomavirus. Start by performing a visual exam of the head, neck, and face, while also listening to any changes or abnormalities in the patient's voice. You are looking for any changes in color, contour, consistency, or function. It is important to explain to the patient what you are doing and why you are doing it. When assessing lesions that could be cancerous or precancerous, look for asymmetry, border irregularity, variation in color, diameters greater than 6 millimeters, and or a lesion that has changed over time. Always inspect visually and then palpate.
So we're going to start here.
Begin by using bilateral palpation to palpate the pre- and post-auricular nodes, followed by the occipital, submental, and submandibular nodes. Use bimanual palpation to palpate the nodes of the cervical chain, having the patient drop their chin to each side to allow for palpation around the sternocleidomastoid muscle. Next, check the temporomandibular joint using bilateral palpation as the patient opens and closes their mouth. Notice any popping, clicking, or tenderness. Evaluate the thyroid using bidigital palpation and watch the patient swallow. Evaluate the lips with the mouth both open and closed. Check for changes around the vermilion border, cracks, blisters, or ulcerations. Using bidigital palpation, use your thumb and index finger to palpate the lips. Pull the lips to evaluate the vestibules and to check for adequate movement of the frena. Use a mouth mirror or tongue depressor to pull cheeks out of the way to evaluate the buccal mucosa. Be sure to check the vestibules, mucobuccal folds, and parotid glands. Next, evaluate the hard palate for any bony growths such as tori or for other growths or ulcers. Use bimanual palpation to evaluate the floor of the mouth. Place one hand inside the mouth and one hand below the chin to check for any elevated, depressed, flat, or indurated lesions. Have the patient say ah while you depress the tongue to evaluate the soft palate and oral pharynx, checking for abnormalities in color, size, shape, or lesions. Now evaluate the tongue using a sweeping motion to check behind the circumvallate papilla at the dorsal surface. Use gauze to grab the tongue and examine the lateral borders on each side. Have the patient lift their tongue so that you can evaluate the ventral surface as well as check the ductal openings of Wharton's duct to ensure adequate salivary flow. Oral cancer exams should be performed at a minimum 1 time per year to aid in early detection and help to reduce the number of fatalities caused by oral cancer.